Good morning, everyone. So thanks to Rob and Sergey, who've given a really nice picture of the hardware and device side of things. A lot of my research focuses more on the data analysis side and modeling of data, particularly from smartphone and wearable devices. And we use that data to infer someone's health status, or we can look at behaviour change. But recently, a lot of the wider picture is to help people to self-manage their health, particularly in the home and the community. And I think one of the areas of the focus for this future blood testing network is to consider how remote blood testing technologies can be developed, and the data from those can be used to complement the current digital biomarkers that we use from these smartphone and wearable devices we currently have. So the NHS long-term plan has a lot of mention of the importance of self-management going forward to reduce the pressures on hospitals and surgery services. And you can see from the quotes on the right-hand side here that digital technology is really the underpinning aspect of delivering that and helping people to self-manage their healthcare. So, for example, the use of mobile monitoring devices for people with long-term conditions, and also staff having access to mobile digital services. So smartphones have taken over our life in many ways, and it's equally important for our managing our health, as Adrian mentioned at the beginning of the talks. We can use the objective sensor data from smartphone devices, and we can combine that with self-report data, often captured through many health apps. And this can be then used to drive the user content. So the patient can be supported in their self-management of their health. We can drive behaviour change, or we can provide guidance and support as well, for example, in physiotherapy. But importantly, that data can also be used on the clinical side. So rather than just having periodic assessments every quarter or every 6 months, we can now achieve continuous health monitoring from the data that we get from these devices. We can also monitor people's adherence to interventions, or we can look at sudden events such as a fall, for example, and that can trigger alarms, etc. Also, equally important though is the research side, and we can use this because we've got such prevalence in smartphones and such large data sets coming from them. We can develop databases that can be used on the research side for producing data-driven analyses and getting better predictive modelling of health and stratifying different health conditions, for example. So currently, in terms of digital markers on these devices, we're quite limited in the number of sensors. We can capture activity, we can measure the heart rate, we can also measure heart rate variability, which can be an indicator of stress, and also heart rate irregularity, for example, to detect atrial fibrillation. Importantly, a lot of some of the smart watches are now becoming medical device approved and actually have ECG measures rather than the sort of standard optical heart rate measure. So we get much more accurate heart rate measures. So the technologies are advancing quite rapidly. We can combine these sensing data to also assess people's sleep quality. And then more recently, some of the smartwatch devices have started to even measure blood pressure using optical sensors, but still quite limited in terms of the need to calibrate with a standard cuff every month or so. So in terms of the conditions we can monitor, a lot of these are obviously musculoskeletal related conditions because of the main sensors being around activity and heart rate. We can measure some cardio-related conditions as well, but the main limitation that we have at the moment with these digital sort of markers is that we don't get a direct understanding of someone's health. We're having to infer their health from these measures, and usually that's relating to their lifestyle impact. So we're looking at sedentary behaviour or poor sleep, and that's indicating higher risk of certain conditions. So we don't get this sort of direct measure of health. And I think this is where the blood testing and remote blood testing technologies coming in that Rob and Sergey have talked about, is where this data can complement the digital markers that we can collect so far. So with blood testing, this opens up a whole range of direct measurements of health conditions, such as liver and kidney function, for example, and inflammatory markers, for example. And this broadens out the number of health conditions that we can measure compared to what we can at the moment with current wearable devices. I mentioned about the research side as well, and this is something that's come up a lot in our other network, plus the OATech network, which focuses on osteoarthritis, and the importance of developing multimodal data sets, so where we can combine these sort of wet biomarkers from blood testing with the digital markers of activity and smartphone devices. And this will, if we can combine these data together into a biobank type databases, we can really improve our understanding of health over time and do much more better modeling. So just to give an example of where we're at currently, one of our partners on this network plus is one of our commercial partners is Humanity Health, and they've recently launched an app that collects the digital markers from the smartphone. So we're looking at movement, heart rate, sleep and mood markers, and they've taken biobank studies, large biobank studies of many thousands of people, and the models that have been developed from these studies to look at how these markers can predict what they call biological age. So this is effectively the rate of aging and a measure of someone's health relative to their current chronological age. So what they do is they take the markers from the individual statistics, they match that to the demographic profile of the model, and then determine that individual's biological age or their rate of aging. And then that can be used to then drive behaviour change in terms of their lifestyle changes. What's interesting is Humanity's next plan is to introduce quarterly blood testing to some of their users. So now what we'll have is another biobank-based model. So this PLOS Medicine study here from 2018, where we have a model of biological age based on the blood biomarkers. This can predict the biological age, but also complement the digital markers that we get from the smartphone as well. So we've got this continuous model here from the digital markers, from the data we get continuously from the smartphone. The quality of that model is lower because it's just using activity and heart rate, for example. But then we have this periodic testing from the blood markers, which is less continuous but high quality data. So we can combine these two data sets together to get a much better prediction of someone's health status, and then obviously use that for both behaviour change but also for health monitoring. So as this is the network to tackle the challenges, these are the main challenges that I see based on some of the research that we've done on the digital marker side, and I think on the data that can come from some of these blood testing devices are equally relevant challenges here as well. So the main one is data quality. When these are remote devices, they're across different manufacturers, and it's hard to know the quality of the data we're getting back. This can relate to both the sensor type in the devices, so we get variability across the manufacturers, and we need some way of quantifying the quality of that data based on the sensor type. So for example, this is done in continuous glucose monitors at the moment, using this mean absolute relative difference measure compared to standard fingerprint blood testing. The other challenge on data quality is user errors. The patient is the end user, so not necessarily fully trained up in using these devices, so we need to minimize the risk of creating user errors when the patient's fitting or using these devices. And that leads on, of course, to then making these devices usable with minimum barriers to usage. And it's important to have formal technology acceptance methods and assessments to ensure that all the barriers are recognised and minimised in terms of usability. And then finally, we've got data integration, which is then what do we do with that data once we've analysed it? Can we get it into electronic health records? Still, this is a major challenge in the digital marker side, and transferring data into from smartphones into medical records as well. It's still a big challenge. EMIS introduced something a few years ago to attempt to do that, but I think that's kind of fallen by the wayside since. So there's still a lot of work to do in terms of data integration, and also, of course, managing privacy and data protection is part of that as well. So that's a very quick overview on the sort of wearable side in terms of data. And yeah, I look forward to discussing these challenges over the next few years within the network. Thank you.